Hello, and a very warm welcome to everyone joining us this evening from different parts of the world for an extremely special occasion. I'm Meera, and on behalf of the Center for Mental Health, Law and Policy at the Indian Law Society in Pune, I'd like to extend a heartfelt thank you to all of you for making the time to be a part of this virtual award ceremony of the first ever Keshav Desiraju Memorial Award for Outstanding Public Service in Mental Health. Today, the 11th of May, marks the birth anniversary of Mr. Keshav Desiraju, an extraordinary individual, a former Union Secretary of the Ministry of Health and Family Welfare and an officer of the Indian Administrative Service. Mr. Desiraju served in multiple positions throughout his long and illustrious career in the Union government, as well as the government of Uttarakhand. A person of impeccable honesty and absolute integrity, he was a dedicated public servant who had an outright sense of duty and a conscientious understanding of right and wrong. In fact, many of Mr. Desiraju's friends, family, and colleagues present here today would agree that he was an exemplary civil servant who gave equal importance to technical experts as well as those working on the ground. And this made him an accessible leader with a remarkable quality to respect and listen. His qualities of humility, integrity, and purpose are what made him a distinguished officer. Mr. Desiraju was a man of many interests that ranged from public healthcare, human rights and social justice, education, environment, and outside of work, art and music. Through his work to build a more just, equitable, and caring country, he dedicated his life to serving society. After his sudden and unexpected demise in September 2021, you'd all recollect that there was an immediate and personal outpour of grief that followed, which is testament to the lives he touched and the deep impact he had on all those around him. To honor his life and legacy, we at the Center for Mental Health, Law and Policy, in association with Thakur Family Foundation, have instituted the Keshav Desiraju Memorial Award for Outstanding Public Service in Mental Health. This is an annual award that aims to recognize the contribution and efforts of individuals in government service who embody similar values as Mr. Desiraju, and through their work are regarded as allies in making advances in the field of mental health in India. And to inaugurate this momentous occasion, it is an absolute honor for me to introduce you to our first guest for the evening, Mr. Gopal Krishna Gandhi. Mr. Gandhi is a former governor of West Bengal and a former High Commissioner to Sri Lanka. He served as an IS officer for nearly 25 years. And after his voluntary retirement from the IS in 1992, he set up the Nehru Center of the High Commission of India in London and became its founding director. He received the Sarvepalli Radhakrishnan Award of the University of Mysore and the Lal Bahadur Shastri Award in 2016 and the Rajiv Gandhi Sadbhavna Award in 2018. Currently, Mr. Gandhi is Distinguished Professor in History and Politics at the Ashoka University. Thank you so much for joining us today, Mr. Gandhi, and I'd like to hand over the mic to you now.
Thank you very much for this very rare and very valued and very precious opportunity. I wish I was greeting Keshav today on his birthday as I did every year, and not speaking of him in the past tense. But then there is such a thing called reality. Keshav was a very real person. He was himself, untypecast, unpredictable. A scholar, if there ever was one. Keshav confounded intellectuals, free thinkers, dissidents, activists, bohemians, by choosing a much traveled by road, the Indian Administrative Service. That particular conformism, being a Sarkari Babu, he wore like a badge of honor, specializing in the ins and outs of that road, which is often a highway, oftener a meandering lane, but always much traveled by. You cannot get more regular than by taking a shot at that public exam, which Keshav did. Keshav did not oblige non-conformism there. But individualists in the civil service, which is a euphemism for misfits, fancying themselves to have a life beyond Sarkari files, take voluntary retirement to become academics and columnists. But Keshav stayed the course doggedly. He knew he could read as much as he wanted to and also do his sarkar work. Writing was different. Writing, yes, that he kept for after he had retired. For writing to him was not a breeze. It was something that carried responsibility, that carried accountability. Where so many of us thought he would, in high dudgeon, fling away his covenant with government after he was so rudely moved out of the Ministry of Health, he did nothing of the kind. He moved to the next job, Consumer Affairs, with a muffled grumble, but nothing more. So if Keshav disappointed radicals, he did not belong to the standard IAS type either. Kuch fark type ka aadmi hai. I can imagine a liveried peon outside his office say to another, सुना है ये किसी बड़े आदमी के पोते हैं, शायद कोई महाराजा टाइप के, कोई साउथ के. Radha Krishnan was never part of his name, but the ancestry hovered around his stature. The silver head of hair, his long bespectacled face, and an English that was a cut above the routine. He never flaunted his family's great name, but he never stood in the way of it being mentioned when it naturally had to be done. He let that part, that description of him as a grandson of Radha Krishnan, sit over him like a shawl, softly, almost incidentally, but very comfortably. No false modesty, no put on humble stuff. Keshav had the natural humility of the real aristocrat of the mind, the becoming modesty of a true patrician, the civility of the cultivated. Nothing of the arrogance, none of the stiffness, not a hint of the pride of the wannabe upper class that wears varnish over very flawed surfaces. Keshav was among friends a Horatio to several Hamlets who lack the prince's eloquent madnesses. This Horatio was wise, circumspect, soft-spoken, and in few words, inviting confidences, keeping confidences, but never playing a role that would have dramatic effects on the play. He was among peers a B.N. Rao to celebrity constitution makers, vastly more knowledgeable than members of the drafting committee, but choosing to stay out of the limelight. He was among books, not the famous David Copperfield or the moving Oliver Twist, but Dickens's less known but greater novel, Hard Times, satirizing society among friends with a mordant but unmalicious humor. He was among paintings, not Picasso's Guernica, not Oliver Twist, like Rembrandt's The Night Watch. He was Constable's great painting, The Cornfield, with a young shepherd boy drinking from a pool in the summer heat. In all that Keshav did, he sought quality, not brilliance, not eminence, not summits, not heights of dizziness or depths of gravity, just quality. He sought the truly such and such, the real, the that is it of things, be it just a tumbler of coffee or conversation or reflection or a Kanjivaram sari for a friend or for a friend's wife or a soft wool cardigan or be it music. Keshav was very fond of Radha Krishnan. He was, there's no denying it. But he was no less fond of his uncle, Saripalli Gopal. And if his uncle was rather taken up with Nehru, Keshav was rather taken up by M.S. Subbulakshmi. He was to pour his heart, mind into his biography of that Wonder Woman. If he was jealous about protecting anything, it was his exclusive understanding of the music of Madurai's daughter. In that sanctum, no one else was allowed to enter. And it is just as well that it was so. He wrote in the next thing to secrecy, which was privacy. Like a pearl in its oyster clasp, that book grew to maturity. The picture on its cover, I told him, has a mischievous smile. MS reminds me in that picture of the phrase, Mukhete Tambulam. She seems to have just had and enjoyed a succulent pan. So she does, Keshav said. So she does. Keshav too had his private rasanubhavas. Keshav did. In work or at rest. The human brain fascinated him. The human heart fascinated him. His sisters he adored. His friends he cherished. The human mind held him in health and in difficulty, in creativity and in limbo. Charles Lamb, it is said, wrote his summaries of Shakespeare's grim plays. He left the happier plays to his sister Mary, who was of disturbed mind. Keshav has left happy memories for us. His grandfather Radhakrishnan once said from his high seat in the Rajya Sabha, there is a touch of ... in all of us. I will not say the word ... All of us know what it is. Keshav knew that touch of ... in all he was friends with and all he was not friends with. And he had compassion for that touch. Keshav, it is miserable to be without you.
Thank you so much, Mr. Gandhi, for joining us on this very special occasion and sharing with us such a detailed and personal reflection of Mr. Desiraju. Thank you again. It fills me with immense pleasure to now introduce and invite our next guest this evening, Ms. Srilata Iyer. Ms. Iyer is Mr. Keshav Desiraju's eldest sister and has been extremely kind to grace this occasion with her presence. Thank you so much, Ms. Iyer, for joining us this evening, and I'd like to hand over the mic to you now.
Thank you. I'm left speechless after listening to Gopal. Thank you for giving me the opportunity to talk about Keshav. When Soumitra requested me to say a few words about my brother Keshav, a man of many facets, I was a little apprehensive. What do I say about a much-loved individual? I will, however, try and share my innermost feelings. Today, the 11th of May, Keshav's birthday, he would have been 67 years old. I recollect that hot summer day in 1955 in Chennai, where he was born. My father had been to Belur a couple of years before that, and when he went to the Chennakeshava temple there, the priest had said to him, Keshava will be born in your house. So it was decided that this little baby boy would be named Keshav. Keshava had indeed been born in this home, as predicted. My maternal grandmother, Amama, used to sing a little lullaby in Telugu that ended with the words, Achamma Pudtadu Buchi Keshavulu, meaning, tiny Keshav will be born here soon. So to all of us in the family, he became Buchike and Boo Mama to his nieces and nephews. Keshav was, and I find it difficult to refer to him in the past tense, a quiet child, soft-spoken, and a very affectionate brother. After schooling at Cathedral and John Convent in Bombay, he studied social sciences at Elphinstone College, and in 1974 read for a second BA in economics at Christ's College, Cambridge. This education formed the basis of his understanding of inequality, a subject reflected in the work he went on to conduct in the civil services, working for the underprivileged in Almora, recognizing mental health and not just physical health as an issue to tackle in India. Another facet was to motivate and mentor, for he had the flair and ability to do so, the young officers at the training academy at Mussoorie, being an excellent role model, much loved and respected. After his master's degree at Harvard, Keshav became very interested in education, the environment, and more importantly, mental health, pioneering the development of India's first Mental Health Care Act in 2017. His social and societal concerns he practiced with a great deal of zeal and enthusiasm in touching and transforming so many lives through his association with NGOs, particularly in the health and education sector. Keshav was always very kind. He was witty, intelligent, and all of us in the family and friends remember the twinkle in his eye and the slight smile. Friends meant a lot to Keshav, friends from different walks of life, and even acquaintances were made to feel important. Keshav was the youngest of us 4 siblings, and each of us carry precious memories of his kindness, how much he remains with us in spirit. Keshav shared, as Gopal mentioned just now, a true passion for Carnatic music, and his excellent biography and much acclaimed book of the singer Srimati M.S. Subbulakshmi, published in December 2020, bears testimony. His other interests in retirement were cooking, baking, and crossword puzzles. Every morning, the Economic Times crossword had to be done with the morning coffee. Glee if he got the word, the clue before I did. And sometimes if it was a difficult clue, he would seek my permission to look for the answer as though that made it permissible. But if I got the right word which he hadn't, there would be silence for a second, and then he would wildly protest that I had had a 14-year head start over him. Miss you, Keshav, miss you very much. I express my grateful thanks to the organizers on behalf of the family for instituting the Keshav Desiraju Memorial Award to honor and perpetuate his legacy for outstanding public services in mental health. Our warmest congratulations to the first recipient. Thank you for asking me to be here this evening.
Thank you so much, Ms. Iyer, for sharing such beautiful memories of Mr. Desiraju with us. And we truly appreciate you making the time to be here with us this evening. Thank you again.
Thank you.
Besides being a part of the disability and rights community at large, Mr. Desiraju was an integral part of our initiatives at the Center for Mental Health Law and Policy. He was a close friend of our director, Dr. Amitabha Bhattacharya, for over a decade, and they worked closely together as part of the Mental Health Policy Group to redesign the district mental health program, as well as to draft India's Mental Health Care of 2017, a legislation that has been widely regarded as bold and progressive. Mr. Desiraju understood mental health and suicide prevention as complex intersectoral issues that are closely tied to areas of social identity and discrimination. He worked to hold the state accountable and uphold principles of human rights and social justice. He enthusiastically supported and advanced our work at the center in numerous ways. In 2020, we at the center, with support from Thakur Family Foundation, launched an important project called the India Mental Health Observatory that focuses on evidence-based policy making for mental health. And when we approached Mr. Desiraju, he graciously accepted to be a part of the steering committee and played an active role in shaping and advising the project. While Mr. Desiraju is no longer with us, his vision for an improved mental health system remains. And today, in his memory, we are honored to announce the renaming of the India Mental Health Observatory. And to formally announce the new name, I'd like to invite the Honorary Secretary of the Indian Law Society, Pune, and the former principal of ILS Law College, Mrs. Vaijayanti Joshi. Mrs. Joshi is a recipient of the prestigious state-level Ashadeep Award by Ashadeep Nyas Panvel for her invaluable contribution to the field of legal education and for more than 2 decades. Her areas of interest are jurisprudence, family law, and administrative law. Thank you so much for your presence this evening, Mrs. Joshi, and I'd like to hand over the mic to you now.
Dear friends, all dignitaries and distinguished invitees, it is indeed a great honor for me to be here amongst all of you, to be speaking here on this occasion on behalf of the Indian Law Society. The Indian Law Society is celebrating 100 years. This is our centenary year. And as was informed to me, I did not know this. It is the birth date of Mr. Keshav Desiraju also. So it is a very good but unfortunate coincidence, I would say. We are having this function today. We are very proud of our Center for Mental Health Law and Policy. It has trailblazing work which speaks for itself. The center's team, under a very able guidance of Dr. Soumitra Pathare's leadership, is working really tirelessly to improve the mental health system in India through research, action, and advocacy. Mr. Desiraju was a close friend of ILS and the entire team of the center, and his support to the Indian Law Society through this Center for Mental Health Law and Policy over all these years has been really very significant. His integrity, dedication, and sharp ability to create change have been an inspiration to many. He is credited as the architect and driving force behind the Mental Health Care Act of 2017, indeed a bold and progressive legislation impacting the lives of thousands of individuals to improve mental health in India. From 2020 until his unfortunate demise in 2021, he was a member of the steering committee for Center's Mental Health India Observatory, an important project at the center focused on evidence-based policy making for mental health funded by the Thakur Family Foundation. To honor his memory, I am really humbled to formally announce the renaming of the project as the Keshav Desiraju India Mental Health Observatory from today onwards. The decision to rename the project has come from the project team and supported by the Thakur Family Foundation. Mr. Desiraju's vision and efforts to advance public mental health in India have shaped the work of the India Mental Health Observatory greatly, and it is only the fitting to honor him as such by renaming the observatory. I now hand over Meera to introduce the work of the observatory and the project in further details. Thank you very much to all of you. Thank you.
Thank you so much, Mrs. Joshi, for being here this evening and formally announcing the renaming of the India Mental Health Observatory. So here's unveiling the new logo. The India Mental Health Observatory is now the Keshav Desiraju India Mental Health Observatory, an initiative of the Center for Mental Health Law and Policy, ILS Pune, funded by Thakur Family Foundation. The Keshav Desiraju India Mental Health Observatory is an open access repository of data and information on mental health laws, policies, and services. While there have been noteworthy developments in the mental health policy and legislative landscape in India, there remain systemic gaps in their implementation, and this impacts the availability of quality rights-based mental health services that are accessible, equitable, and culturally acceptable. There is a need for credible and updated information on the mental health system in the public domain. Established in January 2020, the Keshav Desiraju India Mental Health Observatory aims to promote evidence-based policy making and bridge systemic gaps by engaging with a range of stakeholders to collect, collate, and disseminate data and information on the mental health system at a national, state, and district level. Its work is spread across several cross-cutting thematic focus areas within the mental health system. And some of the project's notable initiatives include Project Siren, which is Suicide Reporting India Watch, that assesses and rates the quality of suicide reporting in print and digital media publications, and also annually awards journalists and publications for their responsible and sensitive reporting on suicide. There is the annual budgetary analysis of the Union Budget for Mental Health, a monitoring framework to track the implementation of the Mental Health Care Act of 2017 in all states across India, the creation of a public archive to make data and information pertaining to mental health and mental disabilities easily accessible to all concerned stakeholders. The Keshav Desiraju India Mental Health Observatory has produced over 35 publications and initiatives in the last 2 years that span the entire mental health system and have been well received and used by different stakeholders in various settings. In the future, the project will continue to build upon its repository and support stakeholders within the community and those engaged in public service to strengthen and advance mental health in India, carrying forward Mr. Desiraju's vision. Many congratulations to the project team and its team of interns for the renaming and their future efforts. Now, before I introduce you to our eminent jury for this year's award, I'd like to take you through, or briefly actually take you through the selection process and methodology that was followed by the jury and the organizing committee for this award. So we invited individuals across the country to nominate themselves or others who met the eligibility criteria. The announcements were made on various social media platforms, our website, as well as through emailers to several individuals and networks. The application form consisted of a set of questions to learn more about the individual, their work, and their future plans to advance the field of mental health in India. The committee received a total of 13 nominations, which were a mix of self-nominations and nominations by others. The jury then individually reviewed and ranked the applicants, and consequently, during a closed-door virtual meeting, discussed and deliberated over each of the nominations to reach a decision on the most deserving nominee for the Keshav Desiraju Memorial Award for Outstanding Public Service in Mental Health for the year 2022. The award recipient will receive a memento and plaque specially designed by artist and sculptor Abir Patwardhan in honor of Mr. Keshav Desiraju. The memento seeks to encapsulate the multifaceted and passionate person that he was. It depicts an organic form, unfurling and flowing, reflecting his generosity and spirit. The award recipient will also receive a certificate and a citation, a cash prize of Rs 50,000, and Mr. Desiraju's last completed work, published in 2021, the critically acclaimed book titled Of Gifted Voice, The Life and Art of M.S. Subbulakshmi. And now, to announce the award, I'd like to call upon our esteemed jury, and it is my absolute privilege to introduce each one of them to you this evening. I'd like to start with Ms. K. Sujata Rao. Ms. Rao is a former Union Secretary of the Ministry of Health and Family Welfare, Government of India. Of her 36 years of service as a civil servant, she spent 20 years in the health sector at the state and federal levels. Ms. Rao holds MA and MPA degrees from Delhi University and Harvard University, as well as prestigious fellowships from Harvard School of Public Health. Ms. Rao has represented India in boards and advisory panels of various international organizations, including the Global Fund for HIV/AIDS, TB and Malaria, WHO and UNAIDS, the Bill and Melinda Gates Foundation, the Public Health Foundation of India, and the National Health Systems Resource Center of the Government of India, among others. Currently, Ms. Rao holds positions as a board member of various NGOs and is also the commissioner of the Lancet Citizens Commission on Reimagining India's Health System, centered around introducing universal health coverage. She is also the author of the book titled Do We Care? India's Health System. Thank you for being a part of the jury, Ms. Rao, and also being present here today. Our next jury member is Mr. Amitabha Bhattacharya. Mr. Bhattacharya, a mechanical engineer by education, joined the Indian Administrative Service in 1975 and was allotted the Andhra Pradesh cadre. He spent over 30 years of his career in various leadership positions at the center and state level. He retired in 2009 as Principal Advisor, Education and Culture from the Planning Commission in New Delhi. He also served the United Nations Development Programme as the Chief of Programs in the field of energy and environment for 5 years. Post his retirement, he served as a Director of Development Consultants Private Limited, where he started his career and has held positions as a Fellow of the Institution of Engineers in India and the Vice President of the Consulting Engineers Association of India. He's been awarded with the Distinguished Alumnus Award by his alma mater, the Bengal Engineering and Science University of Shibpur, now known as the Indian Institute of Engineering, Science and Technology, Shibpur. He now writes on issues of public interest for various newspapers and journals. In 1987, Mr. Bhattacharya joined the Lal Bahadur Shastri National Academy of Administration in Mussoorie as a faculty member when he first met Mr. Keshav Desiraju, and their friendship continued over years. Thank you so much, Mr. Bhattacharya, for being a part of the jury and also joining us this evening. Our third jury member is Dr. Anand Bhan. Dr. Bhan is trained as a medical doctor with a master's degree in bioethics from the University of Toronto. He's an adjunct visiting professor at Yenepoya, deemed to be university, and is immediate past president of the International Association of Bioethics. His work is focused on ethics and equity in health, mental health, digital health, public health ethics, research ethics, community engagement, ethics of innovative technologies, and ethics training for professionals. Dr. Bhan has been a resource person for trainings and serves as a guest faculty in various educational institutes in India and abroad. He serves as the Bhopal Hub lead for Sangat and is the principal investigator of various projects at the Hub, funded by both international and national funders. Dr. Bhan worked with Mr. Desiraju as a member of the Public Health Advisory Board for the Thakur Family Foundation, and through that experience and related interactions, got to know him and his commitment to public health, mental health, and social justice in India. Thank you, Dr. Bhan, for being part of the jury as well as again joining us this evening. I'd now like to request Ms. Rao to share a few words on the jury's experience through the entire selection process and also announce the first recipient of the Keshav Desiraju Memorial Award for Outstanding Public Service in Mental Health for the year 2022. Over to you, Ms. Rao.
Thank you very much, Meera. Thank you for those introductions and for elaborating the processes of how we arrived at our decision. Friends, Mr. Gandhi, Srilata, and others here on the Samitra and the members of the CMHLP. On behalf of my two colleagues on the jury, both Dr. Anand Bhan and Amitabha Bhattacharya and myself, I would like to say what a great honor it has been for us to be a part of a process initiated to institutionalize the memory of Keshav and his contribution to mental health related issues in India. We would like to thank both Dr. Dinesh Thakur as well as CMHLP for this great initiative. Thank you very much. It was really, it's really very much appreciated by all of us who have worked with him. Keshi was a valued colleague and one of our finest officers. So much more has been said by both Srilata and Mr. Gandhi. I don't think I can say anything more than what they have said and cannot match the wonderful description they have given of the multifaceted personality that Keshav was. He was a man of great integrity as a person and for being able to bring to the policy table issues that really matter to people's lives. He was a team player, a man of great conviction, and had a terrific sense of humor. Keshav has rightly been remembered for his work in the mental health space. A neglected policy area, he brought a rare kind of commitment and passion to ensuring that the issue of mental health is not forgotten, and diligently pursued the matter till the draft bill was passed by the parliament. We have to remember that he retired. He left the ministry, but he still kept an eye on the bill even after he left the ministry to see that it is cleared by the parliament. And in fact, even after the bill was passed, he didn't keep quiet and say, well, my work is done. He chased the ministry to see that the rules are framed within a short period of 6 months. Believe me, any bureaucrat here in this audience will know that, we pass bills, but the rules take sometimes never done, or sometimes takes more than a year, 2 years, or 3 years. Until the rules are framed, nothing really can happen. And Keshav, knowing that, got after the ministry officials and saw to it within 6 months the rules are formulated, and with that, the implementation process really started. I mean, that's real commitment, if there is any. Keshav always felt that by not prioritizing mental health in our policy, we were indeed doing great injustice, not just to those millions who needed our support, but also the army of dedicated people engaged in taking care and looking after the mentally ill. It is in recognition of the huge contribution of all such dedicated people working within the government that most oftentimes go unacknowledged that this award has been instituted. I know that this is one thing that Keshav cared most about, and I have no doubt that wherever he is, he must be happy that we are continuing the work he wanted us to do and would have done if he was alive. We were, I must confess, pleasantly surprised to get a large number of applications from people who are working in the government in the field of mental health. It made choosing the awardee that much of a challenge, and it was not without much discussion and debate that we finally decided on this year's nominee. Each applicant was outstanding, and if we could, we would have liked to have given the award to all of them. We are very happy, pleased, and proud to announce the award to Dr. Chauhan. My hearty congratulations to him. Dr. Chauhan has an impressive career trajectory of working within the system since 2002. He is well recognized within Gujarat, where he has been working in leadership positions. As member of the high-level state and national committees and task forces, he has been able to guide, advise, and influence policy. Dr. Chauhan's work stands out in terms of real-world impact. Despite the tough working environment and often facing resistance from authorities, the way the government works, if there is something that is given a low priority, particularly by the political leadership, then no one really bothers about that area. And so it's very difficult to work on an area which is not a high priority for the senior leadership or for the political leadership. But he solidly stood by, and he made bold moves to advance mental health in the state, advancing the district mental health program, improving accessibility to mental health services, building patient support groups, and enhancing community mental health programs, etc., to name a few. All this at a time when mental health was given no importance and considered a low priority. To keep plodding on thus required a massive devotion and reflected a rare zeal. And it is this quality and lifetime dedication that made Dr. Chauhan stand out, making him our unanimous choice as the first recipient of the Keshav Desiraju Memorial Award for outstanding public service in mental health. I'm really very pleased, Dr. Chauhan. Once again, my hearty congratulations to you. I warmly extend to Dr. Chauhan my congratulations and wish him all success in future years. I do hope he continues to work harder in bringing to the fore issues related to mental health, as we have a very long way to go in our response to this silent crisis. I hope as an inspiring leader in this field, he will nurture, mentor, and build the second line of leaders to take the task forward. I wish him all success. And lastly, I would like to say, never did I ever dream or think that, a day would come when I would be chairing a committee that is a memorial and in memory of Keshav. I really miss him greatly. I feel very sorry that he's not here. I think of him often. Not that we were very much in touch with, on a daily basis, but it was just nice that he was there. He's one person I trusted so implicitly and was greatly fond of. I really do miss Keshav. And once again, I thank Saumitra, I thank his team, I thank Dr. Dinesh Thakur for having made this possible, and to remember Keshav and memorialize him so beautifully, so elegantly, and so meaningfully for him. Mental health really mattered to him a great deal. And I'm really grateful to all of you for pushing through him the cause. And mental health is so critical for India that, he was a champion when alive, and he continues to be a champion when he's not there anymore. Thank you again to all of you. I would like now to request Meera to kindly read out the citation.
Thank you so much, Ms. Rao, Mr. Bhattacharya, and Dr. Bhan. And many congratulations to you, Dr. Chauhan, on behalf of the organizing team on this well-deserved recognition. Before I hand over the mic to you, I'd like to read out the jury's citation. I quote, Ajay Chauhan is awarded the Keshav Desiraju Memorial Award for Outstanding Public Service in Mental Health for the year 2022 for his distinctive and dedicated work in advancing mental health in the state of Gujarat. Dr. Chauhan's training as a psychiatrist and his work as State Nodal Officer for Mental Health in Gujarat since 2006 demonstrate his understanding of the complex and multi-layered issues of mental health, as well as an ability to effectively address issues through good governance and sustained intersectoral collaboration. Dr. Chauhan has overseen the implementation of the Mental Health Care Act 1987 and 2017, and made significant contributions to the advancement of the district mental health program in the state. His personal integrity, ability to innovate and create strong partnerships with civil society organizations and across government ministries and departments is seen through his perseverance through the years with a respectable record, making him a deserving recipient of the award. Dr. Chauhan, congratulations once again, and I'd now like to hand over the mic to you.
Good evening, everybody. This is an inexpressible event for me in my life. At the onset, I wish to thank all the jury members for bestowing me with such an honor on the special awards. And I feel overwhelmed and emotional, and I'm at a loss of words. This is a special moment in my life. I wish thanks entire team of Center for Mental Health Law and Policy and Thakur Foundation for organizing such a highly prestigious award in memory of great leader Mr Keshav Desiraju. I remember Mr Keshav Desiraju. I would like to say that I had opportunity to spend some time and to work with such a great person. I admire him for his passion for development of mental health sectors in the country, and I try to follow him in developing mental health in my state. I remember that when Mr. Desiraju visited Gujarat, he visited my hospitals and see few projects and advised me on how we can improve the mental health sectors in the state. And I have always looked upon him as a great visionary and guide. I am deeply honored by all my superiors for this recognition of my work. I also wish to thank all my colleagues within the state for helping and supporting me for mental health and reaching out the maximum population in the state. Each one of you has enabled me to bring ideas into reality. I also wish to thank my family, friends who have been part of my journey and have stood by me to have been in motivation in my work. With great humility, I accept this award and dedicated it to all my beloved peers.
Thank you so much, Dr. Chauhan, and congratulations once again. Well, that brings us to the end of this very special and emotional evening, if I may say. I'd now like to call upon Dr. Soumitra Pathare, the Director of the Center for Mental Health, Law and Policy at the Indian Law Society in Pune, to deliver a vote of thanks. The floor is yours, Soumitra.
Thank you, Meera. Thank you. This is, as I was saying earlier, this is a very bittersweet kind of a moment and a bittersweet day. For obvious reasons, I'm very pleased that we are doing this, but for equally obvious reasons, I wish I wasn't having to be doing this. In a very paradoxical way, today is the first time since I've known Keshav that I'm remembering him on his birthday. I usually forgot his birthday. I would usually call him up on the 12th, which is tomorrow, and wish him a belated birthday. So it's just ironic that today is the first time ever in my life that I'm actually remembering him on the day of his birthday. I'm not going to take up too much time. I don't have much more to say other than to really start by thanking everyone for being here, all of you, the audience, for joining in today. I would like to thank the Thakur Family Foundation for funding the work of the Keshav Desiraju India Mental Health Observatory. I want to thank our governing council at the Indian Law Society for agreeing to institute the award and also for renaming of the observatory. All of the jury members, the speakers at today's evening, the people who nominated various people and other nominees, Keshav's friends, family from across all of the world. I would also like to thank Abir Patwardhan for the design of that special plaque. And before I forget, I should not forget this, but I really want to thank my entire team. The people who do all the work, the backroom work, which is what makes programs and events and services successful. That's people like Meera, Amity, Sufwan, Ankita, and Manisha, who you probably haven't seen on screen, but who have really kind of working in the back room to keep this moving and going very well. I'm going to also end by just saying, congratulating Dr. Chavan for this award. And I think he's done excellent and amazing work. And I'm quite happy to see him being the first awardee of this award. Thank you so much. And I'm going to hand you back to Meera to close this function.
Thank you so much, Soumitra. And thank you everyone for joining us for this special occasion. And we look forward to your presence in 2023 on the 11th of May for the Keshav Desiraju Memorial Award for Outstanding Public Service in Mental Health. Thank you and good evening.